Hi, I'm Dr. Julie Steinauer. Today I want to talk to you about an activity that we can use in our therapy room with our patients. It's kind of an interesting one. We can use it with tons of different activities in here, but let me just show it to you. And then we'll talk about how you can connect with us. What in the world are these? Okay, kind of heavy. I'll set those down for just a minute. All right, if you're local, call us at 618-288-1489. If you're not local, go to our website at visionforlifeworks.com. You have a couple of choices. You can either click on the questionnaire, fill that out, and you'll get some correspondence from us. Or you can click on the schedule a consultation button and schedule a time to talk with me directly. Now, what in the world are these things here? I'm going to show you one at a time because they are heavy. Well, this is like kind of fashioned like a bike seat. And what we use this for, this one is the big post. And then let me show you the other one that has a small post. All right, same little bike seat here. So what these are for is during vision therapy, sometimes we have some kids who are really, really active. Maybe we might even call them hyperactive, okay? And possibly even hyperactive with like impulse control problems or ADHD type symptoms. Maybe they even have that. Well, in our therapy room, there are tons of uses for these little bike stools. I'm going to show you kind of what happens. Hopefully I don't fall, but we're going to try the hard one. I think I can do it, don't you? Okay, so I've got to get back over here. And I'm just going to show you. Hopefully you can see that good because I'm a good distance away. Okay, I'm doing this in my heels, by the way, just to let you know. All right, see, I can do it. Look, Mom, no hands, okay? So what happens is they can do these activities and sit on the bike seat. They can use the one that has the bigger base or bottom to it if they struggle with sitting still to the point that they would fall out of their chair. You know that there are some kids who are like this. So if that's your child and you're like, I don't think they could do that one, we might start them off on that one bike seat first and then progress them to the one that I'm on that has the little peg. What happens is that if their body is in motion so much that they can't stay focused, this forces their body and their brain to kind of be like balancing and moving. I'm moving around just a little bit with a lot of muscles to stay sitting still without falling off of this. So it actually is really great for these kids because it gives them enough body movement that they don't have to sit in the chair and flop their body around while they're doing the activity. The movement that I am required to use in order to sit on this stool without falling on my butt on the floor is enough for these kids to help them to stay better focused for the activity. Now, another hack that we use for helping kids to kind of sit still and do what we want them to do is sometimes we'll place a book on their head while they're doing an activity. They have to be really body aware. Like, oh, if they lean their head down, the book is going to crash and fall off their head into their lap or on the floor. So there's certain things that we can do to help our patients who maybe are a little distractible, they can't sit still quite as well, and we can help them to be able to focus better so we can achieve the activities visually that we need to do in order to help them with their binocular vision. Now, if you think this one's kind of cool, I think I've done this video in the past, but it's been a long time ago, maybe like 10 years ago. So if you think this is cool, you can dig back in the archives and look at some of our old videos. I probably have one of me sitting on the seat before. But if you like this video, hit the like button. Obviously, subscribe to our YouTube channel if you've not done that already. Click that all bell icon so you get notified for all of our videos because you never know what I'm going to do for the day or what topic I'll talk about. Now, if you want to connect with us and you're local, call us at 618-288-1489. If, however, you're not local and you happen to be someplace else in the world, that's okay too. Go to our website at visionforlifeworks.com and you can do one of two things. You can either schedule a consultation directly with me or you can click on that questionnaire button and fill out a questionnaire and get some feedback about what's going on with your vision. Okay, I'm out of breath because I've been doing lots of videos. And I'm sitting on a little bitty peg, and I think I'm about done with it for the day. It's starting to hurt my thighs. Maybe I should do this more often. Maybe it's good for like the thighs and the glutes. We're doing that in vision therapy too, apparently. Okay, thanks for tuning in.